Hi everyone, a very good morning to you all. I am Paridhi and I am the representative from the team Healthy Minds World. Before I begin, I would just like to confirm that I'm audible to everyone. Okay, perfect. So, thank you so much for joining our session today. And we're here to talk about a specific mental health disorder today, OCD, that is obsessive compulsive disorder, and phobias. And yes, before we start the session, I would quickly want to take you all, especially the ones who are joining us today for the first time. I would like to start with a little introduction about us, Healthy Minds World. As an online platform, we came into being almost 6 months back, which also coincided with the time the lockdown came into place, right? And it was started by Vivek and Pallav. And the idea was that conversations around that time, in terms of understanding the impact not just on our professional lives but also on our personal lives, and their conversations around understanding the impact not just on their lives but as a community, we were facing a very different, a new kind of challenge that had us locked in, not just physically but also psychologically. And I mean, in a country like ours, where even today, unfortunately, mental health still carries a lot of stigma, there's a lot of taboo. I mean, it is still considered a taboo. And conversations in terms of understanding what exactly positive mental well-being is, what are the different aspects of it, how does one go about it, how does one achieve it, was something that we as a team believed that we needed to bring. And definitely we did not want to take the route of just sticking to mental health help, right? We did not want to just provide professional help but also provide a comprehensive understanding, so that uh, someone who isn't just from the field of psychology is able to engage with those conversations, but also for someone who doesn't belong to the field but would like to have a well informed professionals insight into what are the various mental health conditions, how does one identify, how does one essentially deal with it, right, in simpler, easier words, was our main objective. And over the last 6 months, thanks to, I'm sure there are several of you who have also been a part of our journey so far, and it's extremely it definitely inspires us, it keeps us going. Your presence definitely is a great factor. And yes, so for the last 6 months, we've been conducting various workshops and webinars on topics ranging from psychoanalytic school of thought to psychotherapy. There's been clinical psychology, forensic psychology, and a lot more. We will be sharing the links to our website and our social media pages in the chat section below. Please feel free to check them out. And yes, today we've grown into a team of more than 15 plus individuals, led by Khushbu, ranging from mental health experts. So we have senior psychologists, counselors, therapists, as well as marketing professionals. And yes, coming to the session today, I'm not sure how many of you are aware, but we've recently restarted our Sunday webinar series. And this time we've dedicated it to understanding various mental health disorders. So we've covered topics from depression to anxiety and panic disorders. And our intention, as usual, is to understand that what exactly are the different layers of these mental health disorders, how can one identify it, to seek help not just for ourselves but also to enable support for those around us, right? Speaking about OCD, and before I request our speaker for today to join us, I'm going to quickly just take you guys through why we've chosen this particular topic. Now, talking about OCD, I am not sure how many of you would be able to relate, but be it, popular culture, or if we see people around us, OCD, more than a mental health disorder, has kind of become an identity, a tag, right? I mean, to give you examples, if you have watched Friends, which is a popular American TV series, uh, there is this character of Monica who exhibits certain traits which kind of then associate her identity as being OCD, right? So there are a lot of times when her friends, when people around her make fun of her because she possesses certain characteristics. And it's not just that. I mean, even with people around us, when they, when they show certain kind of characteristics, whether I would not want to go into the details, but I'm sure you get where I'm getting at, right? So our idea today is to decode that what are from a professional's perspective, right, that what exactly is obsessive compulsive disorder and what are the other phobias, how does one identify it, especially because in a country like ours, almost 2 to 3% of our population suffers from OCD. And I think what is dangerous is that a lot of it goes undiagnosed, right? As I mentioned, certain instances, right? Even if I have to say, if I have to see people around me, there are a lot of them who go around tagging people. I mean, it kind of becomes like their identity, right? More than the name, you kind of associate them with this particular tag. And as I mentioned, what's even more dangerous is that um, in India, has been minimal research done around OCD. So it's extremely important that there are increased conversations, there is increased awareness as to understand it from a professional's perspective. And yes, I mean, some of the challenges that I think I would want to point out at this moment when it comes to OCD patients are how you know it's extremely imperative that they make people around them, right, their near and dear ones, understand what exactly obsessive compulsive disorder is. How are they able to find right help, how are they able to find the right therapist, how can they apply the right therapeutic and coping techniques, along with I mean, ensuring that they do not slip into depression. So this is essentially our objective for today, to understand obsessive compulsive disorder. And for that, we have with us a very special guest, Aparna, who is a clinical psychologist. Aparna she's the founder of GrayCellsMatter.com, which is a mental health, which is a website that offers mental health services. She is an expert CBT practitioner and a licensed CBT supervisor, having trained under the eminent personality Dr. Andrew Beck. She also has a rich experience in dealing with mental health disorders ranging from schizophrenia to bipolar, depression, anxiety, and somatoform disorder, apart from other phobias and OCD, among others. And she's also a licensed special educator and has worked with organizations as well as institutes, both in India as well as abroad. Hi, Aparna. Thank you for joining us.
Hi Pallavi, thank you for having me. Good morning to
So,
everyone.
very good morning. I was just taking our participants through our topic for today. I was just giving them a brief introduction. And yes, for today's session, we have a few questions that we would want to uh, get your insights on to help us understand OCD better. And as for the participants, if you guys have any questions pertaining to a particular topic that is being discussed at the moment, please do drop them in the chat section, in the Q&A section below, which will help us, navigate them better, which will help our team of panelists to navigate the questions better. Does that work for you? Um, Perfect. I think that's great. On that note, let's start our session for today. To start with, uh, can you help us understand what is the difference between OCD and phobias? And is there a chance that phobias can evolve into OCD or vice versa?
Okay, so first and foremost, what are phobias? So, phobia basically, I'm sure everyone would know, is an irrational fear. That is, why is it irrational? Because when a person is having a phobia, then the magnitude of that fear is much higher than what the threat itself is or what the event is. Uh, Whereas in OCD, the same thing applies, because here the similarity between phobia and OCD is that there is an event, and the magnitude of fear or stress is so high that there is a thought, there is that is associated with it. So it is not the event per se that is problematic, but the thought that is associated with it that leads to all the anxiety and causes all the problems. So this is one similarity. Now, OCD is, as you all know, is comprised of both obsessive and compulsive, obsessions and compulsions. Obsessions being those thoughts, urges, impulses, images that keep recurring, that are uncontrollable, that are intrusive, and they are such they cause so much of anxiety that a person tries to all the time suppress it, tries to control that anxiety by performing certain behavioral acts or certain mental acts. So for example, if a person is thinking that is getting an obsession, that if any of my family members steps out, then he might meet with an accident or some harm will come. So he or she will start praying to God or doing some kind of a chant in her mind or his mind. So that becomes a mental act, so that it gives a bit of a relief in the anxiety. Secondly, the behavioral act. For example, if I think that my hands are full of germs, then I will keep on washing and washing until I think that the germs are no more. So when we do these rituals, then our anxiety comes down a little bit till it comes back again when the obsession again starts. So this is the difference between phobia and OCD. Now, you might feel that they are very similar, but they are essentially very, very different. For example, social phobia, as such, there is a basic difference between how a person with not social phobia, rather phobia, person with phobia and person with OCD processes the stimuli. So, for example, a person with phobia will fear all categories of that particular stimuli. So, if he has the fear of, say, spiders, then he'll be scared of all kinds of spiders. Whereas in OCD, it is not so. It is quite specific in OCD. So, for example, if a person has obsession of, say, contamination, so he might think that he will get germs in his hands, and that might cause him to get, say, HIV. Now he will be very specific that from where he is getting the germs. So for example, if he will be very obsessed about not getting germs from sticky substances like glues. Okay, whereas he will not be obsessed about touching a dirty handle, maybe. Why? Because germs that are coming from glue may be sticky, right? Germs will stick onto the hand, so they are more dangerous. right? So I'll be okay touching a dirty handle, but I'll not be okay touching a glue. Okay, so that way. Then second thing is the severity. Severity is graded in phobia. So for example, if I have a phobia of spider, then my fear for a smaller spider will be less. My fear for a bigger spider will be more. Whereas in OCD, there is no such gradation. In OCD, just they will, kind of form some kind of a rule that, okay, if my hands are full of, if I'm getting this obsession that my hands are full of germs, then if I wash it 10 times, then maybe my hands will be germ free. But now this very, intention that, washing 10 times becomes self sabotaging. So what it does is that after some time the anxiety crops up again because the obsession is there, that the hands have become dirty again. So again and again they will wash with the ritual of washing 10 times. As a result, they can be prone to different skin infection or skin lesions, and a lot of these somatic problems arise because of that. Then another difference could be in terms of, say, the emotions that are felt by people with both these disorders. So, for example, in phobia, the prime what do you call, the emotions are of fear and anxiety. Whereas in OCD, along with fear and anxiety, you also have guilt, shame, disgust, embarrassment, humiliations associated with it. Why? So, for example, if a person has, sexual obsessions, so he may think that, that I would like to perform sexual acts on, some of my relatives. So that itself will make him feel that he is very guilty, because in obsessive compulsive disorder there is something called a thought action fusion, which means that the if you have a thought, then it is equal to doing the action. So if I thought, having a sexual act with a relative of mine, then it means that I'm such a bad person, and that I've, like, I should not be having such a thought. And that if I have a thought, then it is equal to me doing it. You understand? So there is a lot of guilt, shame, disgust and humiliation associated with it.
Right.
Then also there is one more aspect called selective processing. So in phobia, people do a lot of selective processing. That is, they will be fixated on certain aspect of the stimuli. So for example, spider example that I'm taking, maybe they will be more scared of, they will fixate more on the fangs or more on the legs. Whereas in OCD, there is nothing like that. It's just like, basically, like, that rules that, after 10 times my hand will be clean, or maybe even after 10 times my hand is not, some germs will still be there. So something like that. So
Got
this is the basic difference between OCD and phobia.
Thank you. I think that's been a very comprehensive, uh, understanding that you've shared, and I think the example of the spider was extremely clear for one to understand. I think moving on, talking about phobias, is there the possibility that phobias can be developed genetically, and does age play any role when it comes to the development of OCD as well as phobias?
Yeah, so yes, genetically, certainly, phobias and both OCD are very highly correlated with genetics. We see in a lot of studies that whenever we interview people with phobia or OCD, or per se any other mental disorder as well, so genetics plays a very, very high role. Especially in agoraphobia, definitely, they say, like, at least 61% individuals are having a family history, and even OCD is like very high, this thing in genetics. So yes. So can you repeat the other question that you had?
My second question was, do you think age plays any role when it comes to developing OCD or phobias?
So age per se, you cannot say that because I am, 20 years old, I will be getting OCD, or because I am 40 years old, I will be getting this or that. So age per se doesn't, cause a role. But yes, the onset at which a particular disorder manifests, that is very clear. That, for example, in specific phobia, like phobias for animals, and especially animal phobia, like that of I gave you an example of spider, etc. So that is seen like in children from 7 to 11 years or so, something like that. Then even social phobia, it is the bearings of the phobia is there even like before adolescence, but it manifests itself properly around age 30 to 40, between that age range. So like whenever we are taking history of people with social phobia, then we find out that like this man is like say 30, 32 years old, and then we say that okay, when did you start feeling um, afraid, or when did you start feeling scared of being scrutinized by other people, or were you scared when you were kind of performing on the stage, when you were at school, or singing in front of others, or whatever, in class or something like that. Then all the time we find that they say yes to these questions. So yes, I mean, they are there, the symptoms are there right from early age, and gradually, but they show up between 30 to 40. Then agoraphobia also, it's around 17 years they show. But like then here, in only in agoraphobia, they say that uh, like as you grow older, then more risk of agoraphobia is there. So that's how it is. Whereas OCD also, you can think about the onset is 14 years, and like males show more propensity to start OCD as a child. So basically the age at onset will determine that what will be the prognosis, that is what will be the future outcome. So if a child, especially in OCD, so if there is a childhood OCD, then there is a lot likelihood that the OCD will continue for a lifetime. And another fact for OCD is that only if you take treatment will it be remitted, and not otherwise. So this is what I can say about the age association.
Right. I think that kind of explains it. We've been getting a lot of questions pertaining to OCD, and also I'll take a minute to move on to that. Before that, my next question to you is understanding the difference between OCD and OCPD, because there's a lot of confusion between the two. I mean, there are chances of uh, getting confused between the two.
So yeah, OCD, as I said, is comprised of both obsessions and compulsions, as well as the anxiety associated with both obsessions and compulsions. But OCPD, that is obsessive compulsive personality disorder. So the name itself says it is a personality disorder. Personality is something which is enduring, it is pervasive, it is it is there, it is what makes a person, it influences the way a person behaves, it influences the way a person thinks, and all that. So personality is relatively a stable and enduring trait. So here, OCPD per se will not have obsessive obsessions or compulsions. They will not show that. Rather, they will show the maladaptive, enduring patterns of enduring traits, basically. So those basic traits of OCPD will be like something like perfectionism, preoccupation with the details, then hoarding, then um, extreme rigidity of a control of behavior of self and other people, so much so that there is a lot of they will stifle the natural openness or the natural way of life of self for the other person that they are living with. Then there will be a strict morality code, extreme morality, so for themselves also and for the other person. So if if there is a husband and wife, then and one of them is having OCPD, then they will expect that no, the person should not even speak to the opposite sex if that is what his moral code is. So, or even look at some pictures, so it can be that deep. Then it can be, then another one could be something like miserliness, so they become very miserly. So these are some of the traits of these are some of these maladaptive traits of personality, which are OCPD, which will be seen. So these two disorders are definitely very, very different. The only time when we can see that there is an association is that when, like, let's say if you have OCD and like you have a comorbid let's say you have an OCPD and you have a comorbid OCD. So one is, very rarely these conditions are found together, like only about 6 to 8%. And whenever they are together, we see three traits of, say, hoarding, we see perfectionism, and we see preoccupation with details. These three are common in both of these disorders. So, and at the same time, we cannot say that OCPD is a precursor for, OCD, because they are both very, very different. And what we can do is, we can probably work upon, say, um, problems like perfectionism, problems like indecision, something like that, so that we can manage these, like if at all, like there is some kind of a preventive cure or something like that, then we can manage these issues earlier on, so that there could be any chance, there could be some chance of a person not having it. But generally, like, these disorders are not really preventive.
Right. Um, Talking about how, I mean, now that we have a clear understanding of the differences, and especially I think the example that you've shared, right? If in a couple one of them suffers from OCPD, and then in what forms can it be manifested and impact the other person? I think overall, with close family members or even within family members, uh, what do you think? I mean, how can they be impacted if somebody in the family has OCD, and what precautions should be taken by the family and the person who's suffering from OCD themselves to ensure a smooth functioning?
Yeah, so that is a good question. Like, family, how does family get impacted? So, family is very, very severely impacted with a disorder like OCD. For example, like, there is a lot of, work that the family members themselves have to do in order to fall in line with the compulsions of that particular person. So, like, in my experience, I had a child with OCD, a 14-year-old girl that was there, and her mother told me that as soon as she comes, she had a obsession of contamination. So, as soon as she came back from school, uh, she she would ask her mother to wash her bag. She would even ask her mother to wash her books. somehow or the other the mother would kind of do a sponge rubbing over the book so that they don't get soggy, the paper doesn't get soggy. But it was so difficult for them to carry on this, that they had literally, like, they were so severely impacted, and there was too much of family distress that was there. So managing around compulsion is very very distressful for the distressing for the family. Plus at the same time, they will need to avoid those things. So for example, if there is a person is afraid of say germs, so the family will want, they will want the family to adhere to the same compulsion. So for example, if a man comes back, so everyone has to open the shoes outside the door, everyone who comes inside should take a bath before getting in, so there has to be you can't touch anything, so something like that. So there is a lot of family distress, plus lot of social interaction also gets disturbed, because of so much such severe such severe obsession, social interaction will definitely get impacted. So now what are the treatment, what can families do about it? So the main thing that families can do about it is, they can keep their mental health sound by visiting timely to a psychologist or a psychiatrist. Now again the point comes at that, at what point should we visit a psychologist? So the point is that whenever there is a mental disorder, there will be distress within the individual, and there will be distress to other members of the family who are staying with him. That distress is being caused by the behaviors of that person. So the moment there is distress in both or either, they should see a psychologist immediately. So psychologists will help them with psychoeducation means that they will be coached on what kind of disorder it is, what is the nature of the disorder, what are the various characteristics of these disorders, what to expect, what will be the symptoms, and how you can cope with them, etc., etc. So very very important thing is to maintain your own mental health, because it really wreaks havoc on everyone else's mental health as well.
Yeah. That's a good point that one should definitely seek professional help the moment they feel the situation is going out of control. And that kind of answers to those of you who've been also asking about you know what are the best practices
Mhm.
for the same. Moving on, talking about other forms such as social media or online games, do you think these can contribute to OCD in any way? And also, can you throw some light on the latest coping techniques which can be used for clients in this regard?
Yes. So, yes, there are some studies that show that there is a positive correlation between social phobia and OCD. Sorry, not social phobia, sorry, social media and OCD. Yes, a lot of studies, not lot of, but some studies do show. So the main reason behind it is that in OCD, a person wants to. I'm sorry. Is this the right question that I'm addressing?
Yes, yes, social media and if it can contribute to OCD.
Yeah. Okay. So yeah. So usually OCD people, they actually have a great need to control the environment. Now what happens is that when nowadays social media is giving a lot of information, right? So they can learn a lot, right? So when they start using social media, and then they realize that, oh, this is what is also there, that is also there. So gradually they start developing some kind of a fear of missing out. Now, in order to control that, they start looking at social media more and more and more. The more they look, the more they are reinforced by the information that they are getting. The more they are reinforced, the more again. So again, that cyclic process starts. Okay, so that can result into OCD. Yes, it's like an addiction, so that can definitely result in OCD. Now, how to cope with that is, number one, here I think schools will play a very huge role, as well as mental health clinics, NGOs, etc., in spreading awareness of internet addiction. Because usually it is seen that the biggest population of people having internet addiction is that of adolescents, right? So these adolescents, they do not have the skills required to understand that how much is too much. So they actually underestimate the time that they spend and underestimate the problems that will happen because of that. So if you have a lot of awareness programs about internet addiction, how it starts, what are the causes, what are the symptoms, then yes, that can be one of the big preventive feature. Secondly, there are a lot of programs present today that help very young children develop attentiveness, develop response regulation. So it is seen that in young children and adolescents, maybe these brain faculties are not that properly developed, so they are not able to regulate their responses, or they are not able to kind of uh, inhibit their response. So they continuously keep checking the social media, etc. So now what happens is that those programs will help very young children to develop attentiveness, to develop response regulation. I can even tell you, like there are programs like prep and cogent are there, which I regularly use, and I have seen very very good results in children, very small children, like even from say 3 years, 4 years or so. So they have very good they start developing response regulation. Another way you can do it is to identify high risk individuals. So what schools can do is they can periodically circulate some kind of self rating questionnaire, in which questions will be like what do you think about internet addiction, how many hours do you spend every day or on internet, and like if it is is it like something like if you are not given internet access for some time, then do you get angry or irritated or something like that. So it will give so we can screen out a high risk population, and we can then give them therapy as well. Also we can help them teach self monitoring. So what they can do is that they can be taught that, okay, now this is the time I'm taking, and I have understood that say I'm spending say 5 or 6 hours a day every day, and now I have to cut down. So as they gradually cut down, you plan in advance the activities that they will do at that particular time. So that will give them that what time what to do in that particular time that is left.
Right.
Okay. Furthermore, like we usually ADHD is very highly correlated with internet addiction. That is also because of the nature of their disorder. So ADHD, because they have a lot of urge for hyperactivity. So they want some kind of a release. So they go to social media for such kind of a release. Plus schools can also lessen the pressure. So even to relieve the students of pressure, school pressure, they go to internet. Okay, so schools can introduce more of extracurricular activities. So I guess, I mean, like, these, if we follow these kind of strategies, then we can really help curb this problem.
Definitely. I think also it kind of then applies to other, I mean, I mentioned online games as well. So, I mean, these, restrictive apps, if I would say, or, programs can apply to other conditions with similar, that have similar,
Actually, OCD, like, even though they say that social media and video gaming, it is correlated, but it is not that highly correlated with video gaming addiction as it is highly correlated with the social media addiction.
okay,
Yeah.
right. I think that, but your response has been pretty comprehensive, I think, in terms of the approach and how to proceed. So that's a good learning. Moving on, I think we've been getting a lot of questions related to, the rise of certain characteristics related to OCD or phobia, especially during the pandemic. So how do you think has COVID affected or impacted patients who had already been suffering from OCD or phobias?
Yeah, so that is again a very, very good question. Glad you raised it. So now, a very, very basic thing about mental disorders is that the symptoms get relapsed whenever there is a stressful event in the life, or whenever they are going through stressful situations. So it can be, it could be like, change of job, it could be change of, house or location, it could be an birth of a child, or wedding, or something like that. So any kind of events that are stressful will see some rise of relapse of symptoms. So saying that, like, if a person who is going for therapy regularly, so he will be able to cope with these symptoms when they arise, versus a person who's not. Okay, so number one, that's where again I would here emphasize the importance of seeing a psychologist when there is a distress in self and distress in other people. Now COVID per se is not making a person having more symptoms of OCD or phobia or whatever. COVID itself should be taken as a stressful event. So COVID being another stressful event will give rise to symptoms of OCD. So just as any other stressful event will give rise to OCD, similarly COVID also will give rise. So there is no special thing about COVID giving rise to OCD. It is like that for all stressful events. So best is to go to a psychologist, and whenever there is distress to self and others, and take treatment. Because what happens is that when a person is taking treatment, then even though this idea becomes true that stressful events will kind of give a rise in symptoms, the person is able to cope with them better. The symptoms are after a longer duration, they are coming back after a longer duration, they are coming with a lesser intensity, they are coming at a lesser frequency. Because when you are having these coping skills, so what happens is that, say for example, social phobia, if you take, so if I am say scared of giving a presentation in front of my colleagues that happen every day in the daily morning meeting. So now if I am going to a therapy, the therapist will tell me that, okay, the moment you start feeling these symptoms, this is what you need to do. Okay, So here the therapist has created an awareness that there is this symptom, and now the person knows that the moment I feel this, I have to do this. Whereas versus a person who's not taking therapy. So when he's not taking therapy, he will totally be caught up with those symptoms and he will not be able to perform. So that is the difference.
And also, kind of adding on to it, uh, there are certain characteristics, I think, especially, for people who haven't already been diagnosed with, who have undiagnosed OCD or other phobias, and the situation is kind of brought those features to the core. So in such cases, apart, I think, yeah, apart from, seeking professional help, how can, I think, yeah, that kind of then becomes my next question, that what are, effective therapies or other healing modalities that can be used for the treatment of OCD and phobias, which I think can be applied in the current scenario as well.
Yeah. So the common treatment modalities that we take is are, CBT, which is cognitive behavior therapy, as well as exposure response prevention. These two are the major therapies that we do. In exposure response prevention, we try to kind of, expose the person to the anxiety that he's having, and then prevent the compulsions that or any other behavioral or mental acts that he's performing to reduce the anxiety, so we stop them from doing that. Then that is the component of the prevention. So there is exposure to anxiety and prevention of the safety behaviors, what you, that is what you call them, right? So that is one. Then cognitive behavior, so this is the behavior part of the cognitive therapy, cognitive behavior therapy. The cognitive deals with the obsessions, so there we try to make them be aware of the kind of cognitive errors that the person is having. So we deal with that. Another one is mindfulness based CBT is also there. So mindfulness will give the kind of some kind of a non-judgmental acceptance of the anxiety that they are having. So with mindfulness, like, it has been really proved, like a lot of randomized control trials have taken place, which actually say that mindfulness is very very beneficial for, disorders like anxiety disorders, OCD, and depression, and a lot of other disorders. Then another therapy that we can use is hypnotherapy. Hypnotherapy is very very useful. Like a lot of people are very scared of hypnotherapy, and I think that is because of the different kind of presentations that are given by Bollywood and other social media. That if you hypnotize them, this is what will happen, and you will never be back and stuff like that. But it is actually a very 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 good therapy, and lot of modern clinicians are now using CBT with hypnotherapy, because it really helps to remove, like when we use CBT, then maybe some of the residual symptoms may remain, but with hypnotherapy it straight away goes to the subconscious, and tries to uh, and see that from where this is coming, and then tries to the person himself understands that, okay, this is where this problem was coming in, and so this is how it can be fixed. So that's how, so these are the basic treatment modalities that we use.
Right. I have a question from one of the participants pertaining medications
Mhm.
uh, for people with OCPD or OCD. So, what are your thoughts on medications? I mean, is it necessary, or can it be cured without medicines as well?
Oh, again a very very good question. I'm glad that you asked. So, in the clinic setting, lot of people, they come and they simply refuse to take treatment. That is pharmacotherapy or medicinal psychotropic drugs treatment. Okay, so again, there is a lot of stigma attached to taking psychotropic drugs. They think that, you know, a lot of misinformation is there, that they think that they will get addicted to those drugs, or, you know, maybe they will have too many side effects of those drugs. So that is the basic fear that they have. But here I would say that what I advise is that if the symptoms are very mild, then yes, you can, you know, skip the drugs. But if you are not able to handle your symptoms, the anxiety is too much. So then, in order to take therapy itself, you will need the backing of psychotropic drugs. So what they will do is, the psychotropic drugs will help you control your anxiety. When you are more calm, then you are able to understand better. You are able to, you know, kind of take in suggestions better. Take, you know, have more confidence, have more control over yourself when the symptoms are low. So my advice is that start, if you know, you're having too much of anxiety or any other symptoms, then you start both with therapy and with medicines. Gradually, as the therapy progresses, the medicines will reduce and therapy will take a larger role. Now here there is also one more thing that happens, that the moment a person goes and takes drugs and he starts feeling good, he stops therapy. So that is also a very very different and very very difficult aspect. We try to convince the patient that, see, therapy is what is the mainstay. Therapy is what is going to help them cope with their symptoms, you know, when they relapse. It's not just the medicines. So the medicines basically take a lesser role, and therapy takes a major role. So go for both if you're having very very debilitating symptoms, and if not, then you can go for therapy. Or if you want to try therapy first, then try therapy, but eventually you will have to take medicines if symptoms are severe.
Right. I think that's a valid point. Moving on, I think we have another interesting question from one of the participants, which is about cases of OCD in children, and if it's not timely checked or timely diagnosed or treated, do you think it can increase or grow as they grow up?
Yes, yes, symptoms can increase and symptoms can become very, very severe if it is not treated. And basically, when we are doing any kind of mental disorder treatment, then we do not say that, you know, today you have a problem and tomorrow it will not be there after you finish the therapy. It's not like that. So some residual symptoms will remain, but therapy is essential because it will help you cope with those symptoms when they come back. Okay, so what we don't know is what to do when the symptoms come back. So in therapy, that is what we teach them. And it is a mix of, you know, lot of things. Like, therapy is not just like, you know, like an advice or something like that. Therapy is a very very scientific way of dealing with the mental disorder. And it mixes a lot of psychoeducation, which is the understanding of the mental disorder that you are having. So the more understanding you have of your mental disorder, the better you understand your own symptoms, and the better you are able to apply the therapy techniques to that particular symptom, because you are able to understand the logic why a particular technique is being provided to you in the therapy, so that you can, you know, get relief from that symptom.
Totally makes sense. And I think coming from you, it's definitely adds value, especially for the uninitiated ones. It is extremely important. Moving on, talking about treatments, how what are your thoughts on NLP as a tool when it comes to treating OCD?
Yeah, NLP can be combined with hypnotherapy. It's a very very these two are very very closely related therapies, and it can be combined with hypnotherapy to treat OCD. Yes.
Okay. I think we have one last question that we're
Mhm.
gonna take before we close for today. Just a second. Just I think meanwhile, just to sum up, we've had an extremely insightful session, and especially understanding OCD and phobias, the different ways in which it manifests, and definitely when it comes to treatment, I think as you mentioned about the programs, about different ways that we can ensure that we're able to identify, we're able to restrict, and accordingly also ensure that when it comes to these disorders, there's minimal havoc created on our near and dear ones. So I think, yeah, on that note, it's been extremely nice to have you as part, on our session, and thank you so much for sharing these wonderful insights with us. I'm sure everybody, I mean, I'm hoping that all of us will incorporate these learnings, and I think the core message then remains that for timely treatment and for a smooth functioning, it's better that the moment you see any signs, seek professional help. Do not delay. And as we've understood today that there are several wonderful treatment methods as well that can help us out. So thank you so much for thank you to ma'am. Thank you so much for being a part of our session from the entire team of Healthy Minds. Thank you to all the participants for spending your valuable time on a Sunday morning with us. On that note, I would like to take your note, and we will see everyone again next Sunday with a new mental health disorder. And yes,
Thank you, everyone. Thank you for being with me, and I hope this session was helpful to you, and it did give you some insights into OCD and phobias. Thank you so much for having me, Healthy Minds. Thank you so much.
thank you. Bye bye.
Bye.
A clear distinction is often made between the mind and body based on the premise that they both are fundamentally different in nature. But when considering the mental health and physical health, don't you think that they both are interconnected? Mental health is a sensitive topic as there exists a lot of stigma and discrimination around it. Mental illness is assumed to be like an unwanted thought for some time, which will go away on its own. Emotional pain is not as visible as the physical pain. A cut on a finger will receive more attention than the sudden prolonged silence of a person. But do you know that poor mental health leads to an increased risk of developing physical health problems? And similarly, poor physical health can negatively impact a person's mental health, leading to an increased risk of poor health conditions. Stigma and discrimination can also worsen someone's mental health problems and delay or hinder reaching for help and treatment. According to WHO, 1 in 20 Indians suffer from depression. It has also been found that depression is associated with an increased risk of coronary heart disease. Healthy Minds World brings to you a Sunday webinar series, a series of 5 weeks on decoding mental health disorders to eradicate the stigma and myths on various mental health disorders like depression, suicide, anxiety, bipolar, and many more. Every Sunday at 11 a.m. IST, we will understand one mental health disorder from some of the leading psychologists in country.